Welcome back to the Short Coat. Coming to you from the amazing and intense world of med school at the University of Iowa Carver College of Medicine. I'm Dave Etler. That's not important right now. In our last show, we talked about negative feedback. Sometimes it's helpful, sometimes it's less so, sometimes it's nonsense. I'm here with M2 Jay Miller.
Hello.
M2 Srishti Mathur is here.
Hello, hello.
M2 Zach Grissom has claimed a mic.
Hello, hello, hello.
And M2 Sahana Sarin is back.
Hello, 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 hello.
Nice.
You did it.
I had to count on my fingers for that. Welcome to med school. We can't count to 4. Not in my brain while speaking.
That skill has been subsumed by other important skills.
Did you ever play an instrument? No. That's what it is.
Well,
okay.
I played piano for like 2 years, but I don't think that counts.
Okay. Because I was like,
think it
what
might
do you
count.
mean you can't count in your head while you're doing something else?
Okay, well,
As someone
then
who
I
also played piano for like 2 years, I think it counts.
Okay, it counts.
Okay.
I played an instrument.
There we go.
Me too.
Yeah.
Played violin, played piano.
Mm-hmm.
That's all I got.
Nerd.
Yeah.
I also played the violin.
What did you
I
play?
played my voice.
Violin and flute.
Okay.
I played violin for 9 years
Oh,
when I
wow.
was in Suzuki method. I
Oh
don't know
my
if that rings a
God.
bell. Did you do Suzuki method?
No, we couldn't afford it.
I don't think I was all that rich, but I don't really know. Maybe that's why my parents drove a 1970 Pontiac
It's okay,
Le
I
Mans for
wasn't-
so many years.
I wasn't good at the violin either. So, like, I don't think this is...
I don't know if I was
I
either,
don't
but
think
it's
it would
fine.
help
There was
me.
some next step after.
Yeah.
Yeah.
We're here today to continue our discussion on feedback, and particularly how to take it. When I think about feedback, I'm thinking of things intentionally said or written that's intended to change behavior. But a lot of times feedback comes from a look, a side remark, a feeling you get from an interaction. Is that valid? I mean, do you guys get that? Should I not have brought it up?
No, so
We're all silently...
Yeah,
You're all, The feedback I'm getting is that was a dumb thing to say, Dave.
No.
so there's definitely what are you pulling the asshole
Anyone
cards
who
out
gives
for?
any feedback?
Like when talking with someone, I think something that at least is in the zeitgeist for students going into shut up
Of all the words.
You got this.
for students going into like the clinical space is that you just need to read the room,
Sure.
right?
Mhm.
And
Yes,
so being able
actually.
to pick up on nonverbal feedback about when is an appropriate time to discuss something, and that's not even like obviously not talking about like the super negative aspects of a prognosis that we're not having that current discussion with the patient.
Yeah, like,
with or
hey, now that you
something.
told the patient that, let's really talk about the terrible things that they can expect.
But
Like,
but
maybe not the
instead, like even in the charting room or something, if you are not getting those nonverbal feedbacks of like engagement with that conversation that you're trying to have with the resident or the attending or something, that doesn't mean like it's time to go like disappear, but it also means maybe you need to like cut back on what you're doing and see what other people are like working on, and if you're like disrupting that aspect.
Yeah. I imagine that's a particular place where people are just trying to work. You know, maybe
Yeah,
they've
they don't
got
want
some
this
things that are.
silly little med student
Well,
away.
I mean, they probably wouldn't mind it if they had finished the thing that they were starting until you walked in and wanted to talk about whatever it is you want to talk about.
Like I was shadowing an ER doc, and he was talking about like picking this versus that on an antibiotic, and I just like asked, I was like, I couldn't remember from my micro class. I was like, what's kind of the mechanism there? And he was just like, I don't know. And I was like, okay, so that's not the kind of like question to engage him with, because he did not care. He just knew,
Yeah.
if I think this thing, we're going to give it this one. And I was like, okay, that's fine. That's fine for his like style of practice and his patient population and everything.
That would be like a secret clue to be like, okay, now I'm going to go to research that mechanism, and I'm going to come back and do like a presentation at rounds about this question that I have. I don't know if that's I think that's a thing that
Ask
people.
us in a year.
Yeah.
Yeah.
We have
You'll
no
find out. I feel like at times they're like, I don't know. Why don't you go look it up and teach us
And other
about
times
it?
they're like, I
Yeah,
don't know.
he didn't say go
I don't
look
know,
it
I
up. He
don't
was
know.
just like,
I
I don't know.
I don't know.
Yeah.
Don't care.
I don't know. I'm gonna continue fighting with Cerner. Was his opinion?
Yeah. I will say, kind of combining what we were talking about earlier too, is I had an SP last semester, I think. And they were like in pain. This is a standardized patient who like you do fake clinical scenarios with.
Yeah.
And they were in pain and I came in and like we're graded and taught that you have to like go in, build rapport, set an agenda, then ask the certain questions that you ask, like see if there's anything else, et cetera, et cetera. And so I went in and like I followed the rubric to the T. I was like, okay, like what brings you, like how are you doing, blah, blah, blah. And at the end of it, she was so mad at me. And I was like, oh my God. And the reason was she was like, I was in physical pain and distress. And you came in and you started asking me about my puppy. And I was like, yes.
Good point.
But at that point, like, I was like, but like at that point, I was like, I was just doing what they told us to. Like, like I'm just listening to like our rubric and like our grading system, blah, blah, blah. And then this time, like we had the same.
Did you say that?
No.
Okay.
It was in my head. And then I was very sad afterwards, though. I was like, oh my God, I did such
You
a
were.
terrible job.
You were.
Yeah, like they've all heard the story.
Yeah.
And then this time around, I went in and like we are doing, it's called PBCR now, which is like patient-based clinical reasoning.
Sure.
And so you go in and like my, now you know. And like my patient was like sitting like holding his head, like it like looking like he was in pain and distress. And I just went in and I was like, what brings you in today? What's going on? Like I was like, we're not building rapport, whatever, it's fine. And I brought it up afterwards and I was like, hey, like, did you prefer that? Because I've gotten feedback in the past that like I shouldn't build rapport. And so I know this time I wasn't following the rubric. Like I was going on my own. And he was like, honestly, I thought that was so much better.
Yeah.
And so I was like, that feedback that I was so upset about a year ago helped me so much in this instance.
Yeah.
Where like I had to read the room and
You
figure it out.
you had to learn that not every situation needs to follow the rubric. you
Yeah,
know,
absolutely.
Especially in
because that's
medicine.
life.
And like, so I did Miko over the summer. I don't know what
Another
it stands for.
medical education.
I don't know what it's
medical
called.
education and community orientation.
Orientation.
I've heard people who
not
actually have done
orientation?
I've heard people who have actually done Miko say that wrong. Like they just don't.
Bro,
know the
I was
acronym.
about to say outreach. I don't
Yeah,
know.
I thought it was outreach too.
That,
Maybe
yeah,
it
I've
is
heard
outreach.
outreach.
Yeah.
It's orientation.
Okay.
Oh.
Okay,
It's
cool.
orientation.
I don't know
Yeah.
that. But
Anyway, it's a rural health rotation
Yeah.
basically for preclinical students.
Yes.
Yeah.
and like I have an interest in family med, so like that's why I did it, because they like, at least in my case, they like set me up with a family med doc, and then I could see other fields, but my home base was family med. And I got, honestly, it was like a trial run of preclinic. It was a trial run of clinicals, because he would be like, "Here's my patient list. Go figure it out."
What do they have?
Yeah, but like there's no grade attached, it was really nice, and I feel like significantly more prepared for clinicals. But like it was, I'd walk into the room and you have to like very quickly read the room and figure out how they're feeling, because I would have patients who wanted to throw water bottles at me, and then I had patients who wanted to sit there and talk for 30 minutes about their hurting knee, and like you have to figure that out.
This strikes me as a
spot.
really difficult thing to do at first. You know, like
It was.
I mean, you would think like, oh, I can walk into a room and read the room,
I
but
don't know. I've worked in family med before, so I had a little bit
So
of
you had some
practice. Yeah. But yeah, it was very much like I had to figure it out in the moment, and like I can't sit there and build rapport
Yeah.
if like they don't want to, and like you have to figure that out.
as a patient, I give you 2 minutes to discuss things that I'm not there for.
I would say 2
And then
minutes
I'm
is a
like-
lot.
Sometimes
Yeah.
2 minutes is too long.
Yeah.
My
way too
patient
long.
had a subarachnoid hemorrhage, okay? He was not going to sit there for 2 minutes and let me talk to him about board games.
Yeah.
Like, he had other things
he had
going on
things
in
to
his
do, yeah.
life.
With me at this moment, you probably get about 15 to 30 seconds.
Awesome. Awesome. That might actually be better. I don't.
I think I usually go, "How's your day? How's it been going so far?" And then I jump in.
Yeah.
But sometimes patients want more. Like
Well, if you continue the conversation and you find opportunities to
Yeah.
and like you have to
to
like
build
let the
rapport,
patient
like, that's
lead.
more interactive than
Yeah.
you know. Hey, how did you find your parking?
I
space?
hate
Like,
that question. How did you get in today? No one
Nobody
cares.
cares. I've also been told not to ask patients like, "How are you doing today?" or like, "How was your day?" Because it's like, what if it was terrible?
Yeah.
I also
Why would you like start? And I was like, okay.
Yeah,
I've also gotten the answer like, oh, well, I'm here, so obviously
Yeah,
it's
not
bad. I'm like,
great.
you know what? That's
That's
fair.
valid.
That's fair.
I want to hear. So Sahana, you shared what I think might be great feedback that you got.
Not at the moment.
Feedback that changed, but it changed
Absolutely.
how you did things.
Yeah.
Anybody else have a bit of feedback that they want to share that they got that was like, oh, this changed everything?
I got the exact same feedback, and it made me better at reading patients.
Yeah,
You know,
okay.
because I didn't have a patient who was in pain, but she was like visibly it was a fake patient. Visibly.
We call them
anxious.
standardized patients or simulated patients. Jay.
God, Jay.
There's some more feedback for you.
My
Jesus.
fake patient.
I literally don't care.
And that's an example of blatantly ignoring feedback.
That's how you don't take feedback. Was just visibly anxious, and so I tried. I gave like an attempt with the rapport building, but she wasn't having any of it. So I read that, moved into her chief complaint, and also complimented me on it. Was like, good. I didn't want to do that.
Yeah.
I wanted to
Get
Get on
going.
it.
I want to get things going. Yeah.
Yeah.
Like I'm here for a reason.
Mm-hmm.
I had one that I don't know that I would change based off of this one. So in one kind of practice run that we had with an SP, we had one person kind of begin the interview and everyone else is outside of the room watching it by video, and then the next person that's going to go in is going to do the physical exam. So
This
I'm
sounds
not
a lot
the one.
worse than it is, I promise.
No,
So-
I
Whoever's
hated mine.
listening.
So
I hated doing this.
I'm not the one asking the questions or guiding the discussion, but I'm going to be the one that goes in and needs to have selected like my physical exam options and follow-up questions that I might have in there
Based on what you saw.
based on what I saw. So I'm trying to take
On a tiny
notes
little
on
monitor.
yeah. So I'm trying to take some notes with that in mind and then come in, and the feedback that I got was that I was choosing to reference or beginning to speak while I was looking and then looking back up to them and looking at what I had done. And I felt like that was unnecessarily pointed on like an artifact of the
situation.
like of the situation that I hadn't begun that interview to do it. And so that was like the entirety of that SP's kind of feedback for me was based around me referencing what I had written down so that I didn't forget things while still going and making eye contact.
So you're
that was
doing
like-
your best in that situation to do what they might want you to do. which
Yeah,
is to
and it wasn't
engage with
and,
them.
and it was
visually.
sort of the lack of value was because it became the only thing that got provided as
Yeah.
feedback to me. I'm fine getting negative feedback, but there were other things that I'm sure I could have
No,
gotten
you were just
negative or
perfect.
no negative or constructive feedback about. But if that's the only thing that gets talked about for like 3 minutes straight,
And it was based on a unique situation that
On a
you would
unique-
never find.
Yeah.
Well, likely never find.
yeah, because we were supposed to kind of pick it up as if you were the same person the whole
Doing it.
time versus getting a verbal presentation from, say, an M2 when you're an M3, and then going in and you doing the physical exam while also asking and like re-asking questions and things like that. Like that's different than what the scenario I was supposed to kind of play.
Maybe I'm too lenient, but I don't feel like that's great feedback. I feel like
Yeah,
I feel like I would rather have my clinician like say things back to me that were accurate rather than rely upon them. I mean, if they were good at
Yeah.
that, then I wouldn't notice it.
hmm
But I don't know. Okay.
I thought that one was particularly unfair because we were in the same group when we got that feedback, and it's not like he underprepared or anything. It's just he had to pick up a patient in the middle of the encounter and go in and do, I think it was like physical exam
Yeah.
and figure
Yeah.
out what to do. And also sometimes physicians need to look at their notes. It may not be the best
that's what
for patients.
that's what I'm arguing. Like,
Yeah.
like
I know there is there is a line, I see a lot of TikTok skits of the person clacking away at their keyboard, not looking at the patient at all. And that sucks. Like, as a patient, you don't want that. But I also so
I don't mind. Future reference if you ever become my doctor, which you won't, because I won't allow it. But
that's fair.
Not that you're not great doctors,
Wouldn't trust us?
great future doctors. But,
No, that's fair.
He's heard how we take feedback, and he's
He's like, I don't want this.
anyway.
It's like I watch these guys cry over an M1 exam. I don't want this.
Yeah. So, okay. What do you take away from that, though? I mean,
So-
you got to take. Oh, were you?
Yeah. So what
Lost
I
track of
started
where we were.
doing, God, Dave, Jesus.
Sorry.
Well, I started doing I at the beginning of each encounter, because I need to write stuff down. I can't remember anything. I have the memory of a goldfish.
Right. I know that. It's true.
Memento.
Sorry, what? Sorry.
what does PCS stand for?
What? No. Nico? What? But I start each encounter with saying hey, just so you know, I am taking notes just so I can keep track of what we're talking about, but I am listening to you, and I don't want you to think that I'm just ignoring you when I'm writing stuff down. And I got feedback once that was a really good thing to say, because it added transparency to what I was doing. And the SP was I wish if I went to the doctor and they're clicking away at their computer, if they told me something like that hey, I'm actively engaged in this conversation, I'm looking through your past medical records or looking through those things, I would feel better as a patient. Because otherwise, if you're just clacking away at a keyboard, it feels like you're disengaged.
Is that what they call signposting?
Yes.
Okay.
I don't know, I wouldn't remember.
Maybe I should ask someone else.
Let's go signposting.
So let's establish. Got more to talk about. Let's establish sort of how to take feedback, especially when it's negative. Just to give listeners who haven't been subjected to this environment, something to hang their hats on when it's their turn. From my research, when you get negative feedback, pause first. So don't react defensively. And that includes, I think, explaining why you did what you did or the way you did it.
Biggest pet peeve.
You don't need to do that. It's super tempting because you want them to understand why, but it just comes off as defensive and not especially useful.
I remember the place where I practiced that skill the most. I took a creative writing workshop in undergrad, and we would submit a piece.
Yeah.
And then they would go around the room and give us our comments. And the one rule was I had to shut up.
Yeah.
I was not allowed to say anything.
Yeah.
And it's so hard.
Yeah. Yeah.
Especially with creative writing, that's a piece of me that's out there, and
yeah.
they're ripping it to shreds, and your first instinct is no, that's not what I meant, or no, that's not what was in the, but that was a really good way to practice that skill of,
if you're reacting in the moment, you're not listening to the feedback.
exactly, because I had to sit and listen to all 20 of my peers talk, and then I could respond. And by the time it came back around, I was able to synthesize what they were saying.
Yeah. So next would be mine for value. So vague comments, even vague comments can contain some kernel of truth. So if somebody says you need to be more confident, I don't know, what does confident look like? So to spend some time.
God, I get that all the time.
So
I find that hard to believe.
I would
Sahana.
say
I
the
feel
way-
like you're super
oh my
confident.
God, you have no idea.
I would say the way to take that feedback is
Be more
If-
confident.
if
yeah,
you
of
can,
course.
you got to be confident enough to do this then. But if you can, calmly ask them for a specific example, because that's going to mean something different to different
Yes.
people for what that confidence is. Are they talking about in the room when they see you with a patient, or are they talking about when you have seen a patient by yourself and come out and presented what is the thing that they think that you need to be more confident at?
Yeah. Yes, in fact, that was my next thing is clarify.
Wow.
What do you mean? What do you mean by that?
Maybe be more patient.
Yeah, maybe let him
Be more
finish.
curious.
No, I actually was in the moment thinking, should I say that was what I meant? Does that I'm getting a little paranoid about this
Be more
conversation now.
confident.
I'm going to be more confident. That's what I was going to say. Separate style from substance. So sometimes delivery is not the greatest, but the core point is still there if you can figure out what it is. Disregard respectfully. Not all feedback is valid. So, you got to weigh the source and the context. I don't think you need to say, I don't agree with any of that shit that you told me. That's garbage. But you can certainly say thank you for the feedback.
Yeah.
And then just remember that this is growth mindset framing that you need to be using. This is data. It's not judgment.
Yeah.
And if you can lock that idea in, then anytime somebody says, hey, you need to fix this, is gold.
Yeah.
So
I like that data. Like, it's just a data point.
Yeah. For everyone like listening and everyone here, like, you're going to have so many informal and formal mentors in some way. Some of them, they're, you're going to be unwillingly their mentee. And when you get all of that data from them, the good and the bad advice, that's positive or negative feedback, you can kind of figure out what to take out of that.
So, short coats, if you have something you want to say about today's show, you want to hear us talk about something else someday, if you have any questions, go to theshortcut.com/tell us, send us a message. Otherwise, that's our show. Until next time, I'm Dave Etler saying, don't let the bastards get you down. Say bye, everybody.
Bye.